do have skills that make me a nightmare for people like you.
Okay guys, so here we are outside Westgate Medical Centre. It's been 9 months and I finally got a response from the Health and Disability Commissioner because they weren't happy with the amount of written information, investigation that he done, and certainly any lack of physical inspections. Okay guys, so as I said back at the medical centre, I got a finding from the Health and Disability Commissioner. This was sent to me in the post a few days ago. It's dated the 2nd February 2018 in regards to, we'll just say, Dr. Incompetent. I write further to one of the HDC workers' emails of the 27th of November. Now remember, I put this complaint in back in June last year, so it's taken them 9 months to do the findings, and fair enough, it's taken them that long to do it properly. They have to get files and data and responses from various people that you're complaining about, but there's a process and I can appreciate that. I've now completed my assessment of your complaint. The purpose of this letter is to summarise the information received during the course of my assessment, advise you of my provisional decision and the reasons for it, and to give you the opportunity to comment or provide additional information before I make a final decision on the matter. My complaint, you have raised concerns about the advice and treatment of your wife received from Dr. Incompetent when she presented to him with a knee injury on 29th of May 2017. You state that Dr. Incompetent did not physically examine her knee and subsequently considered physiotherapy inappropriate at that stage and referred her for a second opinion. Your wife was then seen by Dr. Brilliant, orthopedic surgeon, who considered her knee injury was best treated surgically. What they did is they gained information from an orthopedic surgeon, an independent orthopedic specialist. That orthopedic surgeon had reviewed what both Dr. Incompetent and Dr. Brilliant did. He found that both suggested treatments were okay. She may get what's called stiff knee after a knee surgery, and they found the non-invasive option in physiotherapy was a possible and suitable reasoning. After saying it'll take 4 or 6 weeks to get ACC to pay for the funding to look at a camera, to stick a camera in the knee and have a look, and during that 4 to 6 weeks my wife would just sit there in total fucking agony. Within 2 weeks her leg had swollen 3 times the size because the bone chip that had broken off was bleeding into her leg, and yeah, it wasn't pretty. When we went to the physios, she couldn't even walk up the steps to the physiotherapy, and after realising that they had to help her up the steps, they realised there was no way that she was in any state for physio to recover because she was still injured. Anyway, it is acceptable, both options. Dr. Brilliant thought it was always best to stick with keeping the anatomy of the knee correct and not letting 14 mils of new bone of a horn grow up connected to the ACL. So at the end of the day, the specialist also found it fit to comment about the video recording, which I'm pretty sure that's not under his purview or has fuck all to do with it. He was talking quite sternly about that, to which I responded in regards to that in my response letter to the HDC, telling him he best focus on his job and not try and say that I didn't have the right to do what I had the right to do. Fuck him, quite frankly. Here is the decision by the Deputy Health and Disability Commissioner. Okay, my decision. I acknowledge that you are strongly dissatisfied with the advice given by Dr. Incompetent and I appreciate that given Mrs. Whatnot has since had the benefit of a successful surgical outcome, you feel Dr. Incompetent's advice may have led to unnecessary suffering. However, I accept Dr. Specialist's opinion that Dr. Incompetent's recommendation of non-surgical treatment for your wife's injury was reasonable in the circumstances. I note that Dr. Wonderful's opinion was that the injury was best treated surgically. I believe this represents the divided opinion existent amongst orthopedic surgeons as to the best treatment for an ACL avulsion. I also recognise your concerns about Dr. Incompetent's lack of physical inspection of your wife's injury, and I remain concerned about this, as well as his lack of documentation. I intend to write to Dr. Incompetent recommending that he review his practice in light of Dr. Specialist's findings. He will be required to provide a written report to this office on reflections and changes to his practice which he has instigated as a result of this complaint. With these actions in train, I have concluded my assessment of your complaint and intend to take no further action. However, before making a final decision on this matter, I invite you to comment and provide additional information that may be relevant to my decision. If you wish to make comment, please do so by Friday, by the 16th of February. I responded straight away. If I do not hear from you from this date, I will assume that you do not wish to comment and finalise my decision. Well, I responded back, basically gave them a piece of my mind. He was there to comment on the surgeon's abilities and consultation, not on the fact that I chose to record it. And I would point out, if Dr. Incompetent on the first instant had actually bothered to inspect my wife's leg, I wouldn't have even thought to record the next time because he would have been doing his job properly. But when both of us, when I was wheeling her out in the wheelchair after the first consultation, and because she already has a wheelchair, she's just been in one for 6 years and got back out of it. So when we both exited from his first consultation, we both looked at each other and thought to ourselves, there's something fishy about that. He just didn't do his job properly. He didn't even seem to give a flying fuck about the actual injury, just what was written on paper, and gave an opinion. I don't know about you, but if you hurt yourself in any way, the first thing you do is do a practical examination. You know, you do the twists, pulls, and all that sort of jazz to see if there's been anything done. All I wanted is for this to be brought to the Health and Disability Commissioner's attention and for something to be done. Given Dr. Incompetent's threatening visits from process servers late at night, from lawyers' letters and trespass notices being issued to myself and wife, which I then promptly got rescinded. It's been fun, but I'm happy with the result. Dr. Incompetent now has to have reviews and write what he's changed and to reflect on the fact that he didn't do his job properly, and it is noted on his record. And that's all I ever want. I did not want him to just go unchecked, continually do what he's doing, because it is definitely causing unnecessary harm and suffering. Even though there is varied and divided opinions over to how to treat it between one orthopaedic surgeon to the other, I'm weighing out pain and suffering. And if she was to have 4 to 6 weeks of pain and suffering, when you're coming to surgery involving broken bones, it's always best to get that done as soon as possible from the initial injury, because the bones will start to heal and then you'll have to re-break it and it can just be messier. It's always best to do it the first time. What they actually did was wire the bone fragment with the ACL attached, or the front ligament, back down to where it had broken from, and then just allowed it to heal. And yeah, it still gives her pain, but it will do for a while, because knee injuries are not very easy to get over. Okay guys, so just to finish off with Dr. Incompetent and the Health and Disability Commissioner, this is the final letter I received from him on the 22nd of February 2018. Got it via email, so I printed it out just for you guys so you can have a look. Complaint in Dr. Incompetent. I write further to my letter of the 2nd of February, which you've just heard me read out. In that letter I advised you that my provisional decision to take no further action on your complaint has outlined my reasons for this. You had the opportunity to comment and did so on the 4th of February to write. Thank you for your response and for confirming that you accept my decision. I have summarised your remaining concerns below and I provide my response to them. You are concerned that Dr. Specialist expert opinion was made without evidence that patient's knee was physically examined by Dr. Incompetent. Without this evidence, you state that the opinion was given without all of the facts present. Dr. Specialist's conclusion was that Dr. Incompetent's recommendation of non-surgical treatment for the patient's injury was reasonable. In my view, Dr. Specialist's opinion regarding the appropriateness of the advice given should be read in conjunction with his criticism of Dr. Incompetent's failure to physically examine her knee. Dr. Specialist's opinion was based on the information available, taking account of the fact that there is a disagreement amongst orthopedic surgeons regarding treatments for an ACL avulsion. His advice acknowledged that more information could and should have been obtained and documented by Dr. Incompetent during his consultation, such as a thorough physical examination. As I noted in my provisional decision, I agree that this is concerning. I have asked Dr. Incompetent to provide this office with a written report outlining the changes made to his practice as a result of this complaint. Good. I have now decided to finalise my decision to take no further action on your complaint pursuant to Section 38(1) of the Health and Disability Commissioner Act 1994. Yours sincerely, Rose. Cheers, Rose. Good. That's all my ever point was to make sure that this monkey doesn't continue to practice improperly, to not do physical examinations, to not cause unnecessary harm and suffering to patients that are coming there for his specialist treatment. I think it's good that the Health and Disability Commissioner are making sure that he sends a report back to them to outline what the changes are that he's made. Should we ever cross paths again, I will be taking note again, so bear that in mind. If anybody else comes across something similar, by all means contact me. My phone number, should anyone wish to ring me, is 027 531 4470, or if you're calling from overseas, it's plus 6427 531 4470. Other than that, a good outcome. My wife is pleased that this monkey isn't going to keep doing what he was doing without going unchecked. I believe Westgate Medical Centre have learned a valuable lesson in regards to trespassing law during this. I hope Kristen, or whatever her handle is, isn't too offended with having some education. Never hurts to learn a little bit more, does it, dear? And I do hope no one got any hurt feelings having to trolley on back to the police and rescind their notices that they unlawfully issued. But it's another matter, eh? I would like to say a special thank you to the management of Westgate Medical Centre. Good on them for acting promptly and correcting the flaws in the actions of his underlings. Most appreciated. Other than that, have a good day. Bye all.